Well, welcome to this week's Interviews with Experts. We're very fortunate today to be visiting with one of the leading pediatric psychologists in the country who happens to be on our faculty, Dr. Larry Mullins. So Larry, welcome to our
Thank you.
interview. Would you mind telling us a little bit about what is a pediatric psychologist, and within that, what do you do?
Sure. A pediatric psychologist is typically a clinical psychologist or counseling psychologist who chooses to specialize working with children with chronic health problems, typically sometimes acute health problems. They're very involved in looking at prevention and treatment of any type of health-related difficulty that can take place with a child.
Okay,
So that is the short version.
gotcha. What sorts of things within that do you focus on in your career?
Probably the best way to share that with you is to talk a little bit about just kind of the career trajectory. I started out working in a children's hospital as a consultation liaison psychologist, and so I worked with kids on the medical and surgical units, helping them learn to cope and adjust, and then started my research career, which initially was focused on families of kids with cystic fibrosis, diabetes, spina bifida, and the like. And one of the issues that we became very intrigued with was the fact that the vast majority of these kids and their families actually do very well and are very resilient, but they go through an incredibly stressful experience dealing with the health-related difficulties, dealing with the hospital environment, and it takes a toll. And so over the course of time, we began to really try and create research paradigms that specifically targeted those factors that predict which families do well and which families don't do quite as well over time.
Okay. I know one of the concepts you've studied in your career, and it might be one of those factors, is the concept of illness uncertainty. Can you tell us a little bit more about what that concept is about?
Well, that concept I think is an important one from the standpoint that, as I like to say, people can deal with lots of different kinds of stressors in their life, but the thing they seem to hate the most is dealing with uncertainty, the inability to predict what's going to take place, to deal with uncertain outcomes. Over and over again, our clinical work seemed to suggest that one of the best predictors of how a family copes is their ability to manage the uncertainty around their illness. And as you can imagine, with an illness, there's any number of ways that uncertainty can play itself out. Having to wait on a diagnostic test, having to wait for a diagnosis, having to wait to see whether or not a treatment is going to be effective or not. Typically, physicians are giving you probabilities, and so there's always this level of uncertainty that is there. Mm-hmm. From that standpoint, the goal initially was to kind of document that uncertainty. And time again, we found that was one of the single best predictors of whether or not a family was coping. And then secondarily, we began to look at different ways to teach parents how to manage it, to teach them coping strategies that specifically targeted the uncertainty. And that's what eventually led us to develop some research protocols, some randomized clinical trials that looked at uncertainty management.
Mm-hmm. And that one of those was the Pathways to Coping, which I mentioned in a lecture in the course. Can you tell us from the horse's mouth a little bit about what that program is about?
Sure. That program actually started back around 2000 with Anna Hoff, one of my graduate students, and we thought, well, let's go ahead and put together some kind of a structured program that teaches parents of kids newly diagnosed with diabetes how to cope. And so we developed these very specific modules that we delivered in a structured fashion to parents of kids newly diagnosed, starting with teaching them about the nature of uncertainty. What is it? Why is it important to learn to cope with it? We looked at one module looked specifically at teaching them skills to communicate with medical staff so that they could acquire more information, which we believe would help them manage the uncertainty. There was a module that included looking at how to garner social support, how to get support from others, again, as a way of helping individuals not do away with the uncertainty, but to manage the uncertainty. And so what we found is that by offering these 4 to 6 modules, depending on how it's broken up to parents, that we found that they coped more effectively, their stress levels went down, and indirectly it also went down with their kiddos. The Pathways to Coping program was then further developed to be specific to families of kids newly diagnosed with cancer. And we again kind of piloted that between 2008 and 2010 with the help of a grant, and found indeed once again parents who underwent that particular treatment intervention were significantly better off at the end of the treatment and 2 months later, as were their kids.
And that's interesting because the treatment was targeted totally at the parents, didn't involve the kids at all. Yet there's kind of a contagion effect. If the parents are distressed, the kids are distressed.
Exactly.
And vice versa.
We've known for a long time that one of the other best predictors of kids' adjustment is parents' adjustment. Go figure. But we found that simply by targeting the parents, that it appears to have what some people call downstream effects on the kids. There's a modeling effect, some kind of stress reduction transmission that takes place. But on 3 occasions now, we've seen that kids benefit indirectly. And actually, if you think about it being kind of a cost-effective intervention, if you take into account that some of these kids are too young to participate in an intervention, a sophisticated intervention, it makes sense to focus on the parents.
Well, it makes sense that kids would be looking to the parents to figure out how freaked out should I be. If the parents look freaked out, kids will freak out.
Kids will freak out.
If the parents look like they're coping, the kids will probably respond accordingly. So.
Absolutely.
Well, one thing I like to ask everybody here is, you mentioned your career kind of from your first professional job forward. Can you go back just a couple steps to maybe when you were an undergrad, like the students who are watching this video? What was your pathway to go from in college to this career?
I became involved in research when I was an undergraduate. I worked in 2 different labs. One was more of a social psychology lab. One was more of kind of a traditional psychopathology lab. And I really began to develop a curiosity about research with human beings. And certainly I was interested in working with kids specifically and their families. I then was very fortunate to go to university where I was able to train with one of the first academic pediatric psychologists in the country, Larry Siegel, and started working with him. And he quickly sent me out to a mobile dental unit, excuse me, where Head Start kids were undergoing their first dental procedure without their parents.
Wow.
And I did the distress ratings of the kids, and it was significant. And that was one of my first exposures to pediatric psychology research. So, and that's kind of where it all started. So.
And from there you went straight into a doctoral program, or did you take some time off? Or
I went pretty much straight into a doctoral program, University of Missouri. I took about 6 months off and worked for a while and saved up some money.
Okay. So you kind of knew from that time that pediatric psychology was your thing, and you followed that path right in?
Exactly.
Did a PhD in 5 years, I assume? And
yes.
And the rest you told us earlier.
Right. Graduated when I was 22. No.
Wow. Yeah, right. Well, Larry, thanks so much for your time today. It's very informative.
Absolutely. Thank you.